So our next speaker, we're going to turn our attention to messaging to key audiences, and we will have Luis Garcia join us up here, and his remarks will be focusing on lessons learned from the VERB campaign, specifically reaching Hispanic audiences, and we will have time for a few questions after his presentation. So Luis, if you will come to the podium, he is the president and lead strategist of a marketing firm, MarketVision.
Thank you for the ovation. I know it's about exercise, but I appreciate it anyway. Well, thank you very much. I'm really honored to be here, really feel grateful. Don't feel like I'm an expert on the subject, but certainly had an experience working with CDC on the VERB campaign I'd love to share today. But first of all, I wouldn't be honoring my Mexican heritage if I didn't celebrate 16 de septiembre, so Viva Mexico. I'd at least acknowledge that. Actually, I didn't get instruction on. Oh, there we go. Sorry. So I'm going to talk a little bit today about sort of our approach to communication. It really touches on a lot of the topics that were talked about today in terms of designing a system, in terms of a human-centered approach to purposeful communication, and what Susie talked about with strategic communication. Talk a little bit about VERB, and then maybe just some things that I think as a communications professional interest me that I'd love to just put on the board and see if it resonates with kind of a way forward, some thoughts on a way forward. So really this is what inspires me every day. Our focus is on Hispanic families. All of our work really focuses on understanding how values shape people's beliefs and their behavior. And when we started the VERB journey, I was very, very fortunate 17 years ago, I can't even believe it's been that long, to be selected to work on this campaign. And interestingly enough, so our cohort now, as you know, we started really focusing on tweens, are now having kids of their own. So hopefully some of the habits that we talked a lot about and tried to promote will pass on to the next generation. But this is a really key aspect of how we think as a company, is to really understand the world through the lens of culture. And as we think about human-centered design and applying design thinking to communications, it really is about defining your focus. And Susie talked about it, a lot of you have talked about it today. So not just defining the audience you're focusing on, but also the problem you're trying to tackle. So with something as complex as this subject is, and we've covered a lot of aspects of that today, really defining where the focus should be, empathizing with the people that you're trying to really reach and engage, designing that communication. I was once told, I think I mentioned it earlier, that really everything communicates, whether you purposely designed it to do so or not. So purposely designing that communication, and then having an approach, sort of the old world of creating a message and pushing it out in the world and hoping it works, doesn't work anymore, right? So this constant iteration of messaging, learning, testing, prototyping, and then iterating your solutions is something that we talk a lot about. So it really is, again, this idea that I think it was mentioned earlier about co-designing with messages. With Hispanics in particular, it really is a culture based on collective experience. And so involving the audience in the experience, learning from every engagement, and then evolving your message and the experience that you're designing is really critical. So again, when we started this VERB campaign, it was really the appropriations, the House Appropriations report that sort of set the stage to this. And what was important about that was, again, with such a complex subject, it focused in sort of the energy around, we knew we needed to address the notion of children and young adults and reaching them at an early age. And this is really what motivated the team. We felt like we were on a mission, this sort of data point about 80% of obese children become obese adults. And we wanted to reach specifically tweens 9 to 14 years old, because we felt like that was an audience, that was an age before they develop habits that we could reach and sort of plant the seeds about physical activity. So physical activity was really the problem we were focused on. tweens and their parents, particularly for Hispanic moms, were really the concentration of the campaign. And then the other thing that I give the CDC a lot of credit when they launched this campaign is they didn't just hire one company to find universal insights and appeal to everybody the same way. They recognized that there were audience nuances in different population segments. And so they had specialists in Asian American communication, African American communication, our firm in Hispanic communication, and the American Indian population, and actually experts from kids communication, experts in branding. So it really was a complex team that made the decisions about where to focus. So for us, when we started our research, that sort of cross-functional team that had audience expertise went off and did their own research, and then came together and tried to find, really discovered the universal aspects of what we were learning. For the Hispanic audience, where the values really are shaping what matters to people and shaping their beliefs and their behaviors, it was really about providing for the next generation. So the way in for us was really around parenting and connecting physical activity as a means of really providing for your children. So this idea of providing a better future for my kids was not a value we wanted to change. We wanted to understand that context. But what was happening was being sort of the belief was, as long as my child is well fed, and if they're sick, I go to the doctor. Those were really the indicators of health. And physical activity was not even on the radar screen. It wasn't connected to physical health. It wasn't, my child's health, and it was not connected to family health. So that was really what we wanted to do, was connect physical activity to keeping kids healthy, and then help parents sort of make that pledge. And so we landed on these design challenges, this notion of how might we help kids learn about and choose an activity to keep active 1 hour a day. And the 1 hour a day actually came a little bit later when we decided to hone in on something really tangible that people could do, adopting a behavior that could really be followed. And then for us, particularly in the Hispanic segment, how might we support parents to learn about and pledge their support to keep kids physically active. And so deploying the sort of best practices of branding, we created a brand. And this brand was created from scratch, and it was based on the notion of picking your action word. So pick an action word, make it your activity, and let's get out and play. And really it was a sampling program. It was the idea that physical activity was our product, and we needed to promote it in a way that connected using the same strategic branding campaigns that of the companies that we were in a way competing for attention with, right? So this was a brand for kids. It was really promoting activity as play. So we weren't really trying to talk about physical activity as exercise. It was all about play. It was about fun and about belonging. So we talked a lot about the sort of movement of what you're joining. And it was, again, focused on tweens, delivered in school, delivered in media, really surrounding the audience where they worked, where they went to school, where they played. This was some of the communication. So we had communication that was raising awareness for this campaign at a national level, but then we really honed in on where the gaps were. So these were some of the sort of communication elements that we created in Spanish to address those gaps that I identified that a national campaign wouldn't address. And it was really about these words, these action words, and making it a lot of fun, something that kids would adopt. And then we had the sort of sampling components of it, activities where kids could sample different activities, different ideas of how to stay active. And their parents were also addressed, which I'll talk a little bit about the parental campaign in just a second, but their parents were there to learn about different physical activities, different programs. We could invite partners, the YMCAs, the Boys and Girls Clubs, and the Girl Scouts, and different organizations that were also talking about the programs that they were offering. So these events were extremely successful. One of the iterations as we kind of went down the road of these engagements was we didn't have a program to promote, right? We could go into schools, we could talk about physical activity, but we needed something to sustain activity. And that's what the Yellow Ball program turned out to be. It was a really cool idea. that was generated. This was a group of agencies that worked together. And the yellow ball had a code on the back. We distributed thousands of these across the country. And you would go online and you would put in the code of your ball and you would talk about what your activity was. And you would be able to see where your ball had been and who else played with it and what else they did to it. And it really connected you to a bigger community that was all about the yellow ball. And we had celebrities playing with the yellow ball. We had, and this really spread nationally. So this wasn't, just in the Hispanic audience. This was a broad-based communication. We also knew we needed printed material at the time. There were a lot of lower income schools that didn't have things like school planners. So we created a school planner. Things that teachers could use in schools to actually have daily activities about, physical activity reminders and ideas for kids to be physically active. We had a student magazine, student book covers, things that were just, seemed pretty practical, but very, very useful in the communities that we were serving. And this was the sort of parallel campaign that we created for parents. And it was this idea that active kids make healthy families. So Niños Activos, Familias Sanas was the campaign. And again, it was a movement for parents. We didn't want parents delivering the Verb brand. We wanted Verb to exist in the kid world. And then we wanted a parent brand to really educate parents and help them understand their role, really focused on moms. Some of the initiatives involved partnerships that really were a kind of an iteration. So after we really tried to get the message out, we knew we needed partners. We knew the money was going to run out at some point. We're going to need to sustain initiatives. And developing partnerships with the NBA to refurbish basketball courts in Hispanic neighborhoods, for example, or work that we did with Telemundo to integrate messaging into their telenovelas around physical activity. Partnerships with the NFL that led to the 60 Minutes of Play initiative. So there were a lot of sort of ripple effects, I think, that were created from these partnerships. This was a proclamation of the city of Del Rio down the street from where I live in San Antonio, that the mayor established Niños Activos Familias Sanas Day. And it was a day that still exists today. This was literally 17 years ago, where physical activity is sort of a movement for the day. We had, of course, web components, and this was, way before a lot of interactive elements, social media, for example, existed. A lot of communication that sort of set the stage for parents to support their kids. We even had cushions to go support your kids in sports. Because there was a lot of sort of the kids that were involved in activities would sort of the parents weren't that involved. So we really were trying to encourage parents to be involved. And then we knew we needed things that, again, were going to sustain behavior and be tools that parents could use. So we developed scorecards that also had rewards for kids that some of our partners were able to fulfill. And one of the most important, seems really simple, but one of the most important things we did in events that we found was parents really gravitated to actually signing a pledge. So we had a national pledge of this sort of rolling list of parents that were signing up to really pledge their support for their kids. So this act of joining a movement and being part of this pledge was really powerful. The campaign was very successful in its first year, generating 74% brand awareness. So a brand that didn't even exist, that was built in 1 year. Pretty remarkable when you're competing against the Coca-Colas and the McDonald's, and you saw the numbers earlier of what they're spending. We did have money to work with, but a fraction of what those brands were really promoting. And we proved that we could change behavior. So we actually changed behavior amongst hard-to-reach audiences by increasing physical activity. And I think some of the lessons for me are really around this idea of focus. This is such a complex problem with so many different audiences. Where do we feel we can make the biggest impact? And for us, it was tweens, it was moms, and it was this notion of physical activity and promoting it as a positive pro-social activity. For us, the notion of culture was really important. So telling cultural stories, telling stories that came from people. So again, this kind of human-centered approach to communication that's constantly learning and adapting and telling stories. The use of strategic marketing in health communication. oftentimes we're still, crafting messages, and lots of organizations have to approve a message, and then it takes a long time to get it produced, and we push it out into the world, and we hope it works. The use of this kind of iterative strategic marketing approach is, I think, very, very powerful. And then really a sustained impact through partnerships. There are a lot of companies, a lot of organizations involved in this. So as we think about a way forward, just to kind of address, sort of the world we live in today. So for me, as I was kind of sitting back thinking about this, it's been a long time since we'd worked on this campaign, although we've worked on subsequent initiatives for lots of different organizations. So the world is a completely different place than it was when we started, right? Awareness about health and health consciousness and health information is in a totally different place than it was when we started. It wasn't even obesity wasn't really even being talked about when we started. There's better food options, in a way, improved access, and a lot more awareness that I've learned about in this conference about unintended consequences. So a lot of great information. There's also immediacy as an issue that we're all sort of facing every day. So with technology, with this notion that literally Amazon can deliver whatever you want within 2 hours, is taking the notion of immediacy to a whole nother level. And then the disruption and the decentralization that digital has really created is an opportunity. So it's now one organization or one government that's going to solve this. It's a whole network of a system that was talked about earlier, where we can really personalize messages. Oh, I'm trying to point to people. Sorry. So when the CDC recently released the new prevalence maps, it was shocking to me. I hadn't seen what I'd seen the last years, but just to see Hispanic and African American in the state that I live in Texas. I see it every day. We talk about it in the community in San Antonio. We work across the country, so there were certain places that I was really kind of surprised about. And something that was really interesting to me on the non-Hispanic white map was what stood out is Colorado. And I had just read this article about Leadville, Colorado. And I thought it was so interesting that in Leadville, I thought, here's an environment that's all about health. One of the healthiest states in the country, one of the healthiest towns. It's where the Leadville 100 run happens every year. And yet the data shows that Hispanics are still disproportionately affected by obesity. And you obviously could look at the economic situation, the jobs that Hispanics hold in and around Leadville, and that impacts behavior, certainly. This happens to be an organization that takes kids out into the mountains, hiking and camping, and really tries to promote Hispanics getting out into nature, which is a really incredible program. But it sort of led me to this question of, if we've raised awareness, then where's the problem? I believe in the data. I think research shows that Hispanics are motivated. They see obesity affecting them disproportionately. They see heart disease in their own families. I see it in my own, and so the motivation's there, the intent is there, but trial and change isn't happening. So what are the barriers? What's preventing us? And as we kind of went on, talked to a few families, and these traditions of spending time with family, which is the most important thing, keeping the family together, eating with the family. We have this tradition of sobremesa, just lingering after dinner and just having a conversation, cooking together as a family. So is exercise or physical activity taking away from family time? Is it removing something? Is it something I have to give up to be able to do it? So I think it's really critical as we move forward to frame it as a gain, to frame it as something that's about adding, to your life. It's enhancing the opportunity to connect with your family, to spend time with your family. Instead of sobremesa at the table, how about sobremesa around the block for a walk with the family? So really talking about it being a gain. And then I think about sort of the use of technology, and I'll go quickly because I guess got a little bit of time. is, so how do we tap, into digital technology and immediacy? I'm fascinated by the whole notion of nudging and health nudging messages. We're doing some work for a grocery chain that's delivering personalized meals to families, and we're doing these sort of nudges around, well, how would you like to make a choice today? Replace the steak for salmon, or replace this for a lower calorie option. So really always giving options, but using nudging to kind of break long-term goals down into these micro intentions, I think is really powerful. And also just the whole world of gamification and winning and rewards and things that worked back then and continue to work. This whole idea that I can track my own steps, but I can also track the steps of people in my own family is I think something really interesting that again never existed when we started. And then the whole idea of sort of operating as an organization or us as collaborators in a decentralized world, as technology has sort of really exponentially increased, the centralized organization has decreased. So this opportunity to kind of work as a group of different experts swarming on this problem. I love this podcast. It was actually a while back, but in 2018. And I know you all know more about this subject than even I, but the idea of using swarm intelligence to break a problem down and work on iterative solutions across the country and somehow come together and share those solutions as a group of professionals, I think is a really powerful sort of use of what's going on in the world today. So I'll leave you with one last idea. The idea of sort of creating a cross-functional, collaborative session or organization that really uses design thinking to create and iterate solutions over time, and to do it using swarm intelligence, I think is a really powerful idea that could help not only the organizations that are already involved, but those that want to be involved in this movement. So I'll leave it there.
Thank you very much. We have time for one question. If there's one from the audience, otherwise I have one I can ask. Okay. So, and we'll be having a question and answer session later. So, if you could tell us one thing that we could do to improve our messaging to Hispanic audiences, what would that be?
One thing. Wow. I mean, I think there is not one thing. I guess that's the one thing. No, it's. I really believe in this sort of idea of human-centered, starting with the user in mind, and always starting with empathizing through conversation and really understanding what matters to people, what's important to them. That's what really shaped all of our communication when we really knew that we needed to frame this as sort of walking through the lens of parenting. And so really talking to people, really understanding before we jump into defining what the problem is. Let's first talk to people and understand what is it that they need. So I think that's really the key.
Great. Thank you very much.
You're welcome. Thank you.